So good day, I'm Ivan Clarence Mendaros, second year student from Davao Doctors College, and for today I'm going to perform the newborn cardiopulmonary resuscitation. So since this is a newborn, the first thing to do it will have to do is to determine the baby's APGAR score. APGAR is a quick test done at 1 minute and at 5 minutes after birth. The 1 minute would tell us how well the baby tolerated the birthing process, and the APGAR for 5 minutes would tell us how well the baby is doing outside the mother's womb. Okay, now for this return demo, let's say that the baby has an APGAR score of 3, which is we know falls within the concerning range. So this means that the baby is in need for immediate resuscitation. So after determining the baby's APGAR score, we'll have to stimulate the baby's response through tapping the baby's shoulder, rubbing the soles of the feet, and calling the baby out loud. Baby, baby, are you okay? Baby? Okay. So after doing that, the baby still has no response, we'll have to call out cold blue or doctor squeak so that the doctor and nurses could come over and help us revive the baby. So what we will have to do next is to open the baby's airway. So we'll have to suction the baby's mouth and nose using a suction valve and remove the secretions if there are any that is obstructing the baby's airway. So after that, we can also do the head tilt and chin lift to still open the baby's airway. And since the baby did not respond to the stimulus we did a while ago, we'll have to perform the positive pressure ventilation. So there are two types of positive pressure ventilation or PPT. It could be through the invasive, which is through the use of ventilator, or the non-invasive one, which is through the use of pediatric valve mask. So for this demo, I'm going to use a bag mask. So here is my bag mask. What I'm going to do is to cover the baby's mouth like this, and nose with it now. Hand position would be the thumb and forefinger of one hand will be placed at the rim of the bag mask to ensure the pressure seal, and the remaining fingers will be placed on the jawline of the baby. This is done too so that our hand is not leaning on the patient's eyes, it's not compressing the baby's neck, and is supporting the baby's head. So we'll be delivering oxygen to the baby. So sure, maintain on a proper pacing. So breathe 2 3, 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 breathe 2 3. So PPV should be done for at least 30 seconds or at a rate of 40 to 60 breaths per minute. Now after doing that, someone will be attaching a heart monitor to the baby at a pulse oximeter to keep track of the baby's heart rhythm, because oximeter measure the hemoglobin oxygen saturation, and this will help us monitor the efficacy of the CPR. So there is no increase of heart rate after performing the PPV. We'll have to proceed and perform chest compression and rescue breath. So how are we going to chest compression? So since this is a baby, we can use 2 to 3 fingers and locate the lower half of the breastbone of the baby and start the compressions. But we could also do the 2 technique wherein we're going to encircle the baby's body using our hand circle the thoracic area of the baby, and then let the 2 thumbs rest at the center of the baby's chest and start doing the compressions. But I'm going to do 2 to 3 finger technique. I'm going to begin 30 chest compressions, 2 rescue breath, and chest compressions would be at a depth of 1 inch only, since the baby's bones isn't strong enough, since sturdy enough to handle immense pressure, and we don't want to harm the baby by fracturing the baby's ribcage. Now I'll begin with doing the chest compression. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 8, 9, 30. Okay, breath 2, 3, breath 2, 3. And then do the repeat the chest compressions again. So we'll have to continue doing that for at least 4 cycles, and then if still after doing the CPR there's still no increase of heart rate, we'll have to continue doing the CPR and prepare to assist for an intubation. Intubation is where a doctor will insert a tube through the patient's mouth or nose down to the trachea to keep the trachea open and allow air to pass through. Now, however, if the baby has an increase of heart rate after the compressions and the rescue breathing will, then we can proceed to the post-resuscitative care, wherein we could refer to the post-resuscitation care algorithm, because we could find the procedures and tests that needs to be done to ensure that the baby is doing fine and that the baby's body system are working. So to post resuscitative care, I know is through monitoring the administered oxygen concentration and the arterial oxygen saturation. So after doing everything the procedure will have to proceed to the documentation process, where it will have to input the time it started until time it ended, and also the response of the baby to the medication and treatment for current and future references and further evaluation. And that's all. Thank you.